question for you. You mentioned the lower airway. That's a term I've never heard used before, which is just indicative of the fact that it's not talked about enough. By lower airway, do you mean like everything not related to the facial structure and throat? Are you talking about the torso?
The torso all the way down to the pelvis, really the rest of the body. So I think you have to look at the entire breathing mechanism to see where there's issues. And I would argue sometimes you can have issues in the lower airway that could be impacting things going on in the upper airway. So, for example, when you take a breath of air in, your entire rib cage has to be able to expand in all directions to create space for the air to go. So if someone can't do that, that could potentially lead to movement issues, or contribute to movement issues, I should say. It could potentially contribute to sleep issues. Not only that, but it extends all the way down to the pelvis, because the other thing to think about is when you breathe in, your diaphragm descends. Well, guess what the diaphragm is pushing down on? Your abdominal contents and the viscera. And so how well does the
Like your
ab wall
guts?
have the guts, yeah. So how well does the ab wall expand? How well does the pelvis and the pelvic floor change activity within there to be able to catch the viscera as it descends downward? So then you're looking at how that might influence things in the hips, the feet, things of that nature. And so if someone has any difficulty with that mechanism anywhere along the chain, it could be a contributing factor to some of the issues you might see. And I've seen,
Wow.
yeah, and so like I do a little bit of myofunctional assessment evaluation and treatment. There's been times, Ron, where I've seen someone and I've looked at, if they had a restriction in tongue range of motion, whether you're looking at the tip or the ability to cave. And I've given interventions that did nothing to the tongue, but they did. So I would work on things to improve range of motion in some of those areas that I just talked about. And I've seen drastic changes in the ability to get the tongue placed up to the roof of the mouth just by doing that. And when we talked about exhausting conservative measures, I think a lot of people in this space aren't looking at the impact of the rest of the airway. And there's potentially a ton of real estate that someone could explore that might lead to some favorable improvements in their health and well-being, and it's just not looked at.
Right. For example, when I spoke with Dr. Ting a couple years ago, he said there's 4 parts to the airway, and all 4 of the parts that he described ended here, right? But you're offering a more whole body perspective of the airway, and of course, we know the lungs are here, but you're saying it goes beyond the lungs to the diaphragm, into the area that the diaphragm is trying to expand into, the guts, and then below the guts into the pelvis. That's sort of where the buck stops, but apparently not, because maybe what happens in the legs and in the feet impacts the pelvis all the way up to the top again. So it really is, it's cliche, but it really is a full body thing. It's overwhelming, because as if just worrying about the airway from the throat up wasn't hard enough, right? It's incredibly difficult just to deal with that. Worrying about, well, is it my nasal breathing that's the problem? Is it my oral volume that's the problem? Is it the fact that my mandible is too retruded into my throat? Is it my hyoid bone? Is it a tongue tie? There's a billion and one things you got to worry about just from here. But now you're saying we've also got to worry about blockages elsewhere. But it's a positive message, because maybe the primary problem is in blockages elsewhere. And and I'll ask you about this, about how we fix these things, but you could, I would imagine, fix your diaphragm, fix your lungs, fix your ribs, your hips, your pelvis in ways that don't require orthodontic or surgical intervention. So do you think that this is what you mean when you say a more conservative approach is, let's deal with the torso and the pelvis first, and we can get gains doing that to the airway?